Hello friends, welcome to Hub. I am Dr. Sandip Patel in our special initiative of #Subspecialty Focus. Today we will discuss on why fellowship after orthopedics. So what is the current scenario in orthopedics? Why should one think about subspecialty? Who should think different orthopedic subspecialties, the training options, who can do what, and how to find such fellowships, fraternity recognition in different subspecialty, and at last we'll discuss the recommendations if you are moving towards such orthopedic subspecialties. So if you are new to our this initiative #Subspecialty Focus, I would recommend you to please watch our concept videos, where 3 videos where we have discussed the subspecialty practice overall. One is why fellowship in medical practice, it required different aspects. The subspecialty in medical practice in this separate video where we have covered the different aspects of requirement of subspecialty in a current and in the future trends, what could be the opportunities. And on third videos we have covered different dilemma in subspecialty medical practice, what all factors you need to analyze, different things to consider and evaluate. So please watch that. So let's come to our current topic. So current scenario is in orthopedics, like postgraduate courses are available, MS, DNB, Diploma Ortho in orthopedics. Also globally we see MED, Master of Medicine in orthopedics. In some countries there are MD in orthopedics, but overall these all are post-graduation courses. So after such courses, usually the graduates and the fellows who passed out, they go for the senior residency or join as an assistant consultant or an associate consultant or a consultant in different hospitals or institute level. In tier 1 and tier 2 city, we see the current scenario of establishing the orthopedic subspecialty, and in such cities you will observe that the basic orthopedic practice has already well established and on a plateau. So the new doctors, if they are going to practice in that particular city, the requirement of is different in that city, so you need to think about it. Increasing patient awareness also a concern. Also patient has now aware, they are identifying different subspecialties. At least in a tier 1 city, the educated population is also getting know about different things. The subspecialty fraternity has also developed so far. National and international societies and professional bodies are there, and also the dedicated orthopedic centers, and on a tertiary care hospitals and institutes you will observe different subspecialty clinics and departments are available. So why should I think about orthopedic subspecialty? So there is the practice trend in tier 1 and tier 2 cities. Also in developed country, it has already established such subspecialties. The patient demand in terms of service, in terms of special attention, clinical outcome, limitations in general orthopedic practice. If you are a general orthopedician and you are overworked, the work burden, you are daily seeing different types of patients, trauma, joint replacement, arthroscopy, or joint problem patients, you are managing them. So along with this general orthopedics practice, there are challenges also, and there are limitations while doing all this work at a time in your practice. The focused medical practice will give you a better patient satisfaction and good patient outcome as compared to general practice. And also the fraternity recognition we need to consider, we'll discuss later on in this video. And you will get the expert status once you are trained in particular subspecialty among the general fraternity, among the other orthopedics. You also get recognized in terms of your knowledge, skill also. So all these things has created an industry need for upcoming graduates to think about such orthopedic subspecialty. Now who should think? So we have divided two groups, where either you are currently practicing as an orthopedic surgeon, or you are resident doctors, or you are in a near future you are graduating postgraduate course and becoming and completing your orthopedic training. So first group, practicing orthopedic surgeons, they might be currently overworked. The workload of general practice, challenges in managing trauma and emergency at a time, your plan work, like you are doing joint replacement surgery, also you are doing trauma and emergency you are attending, so it is difficult to manage. You might be getting the situation, you might be thinking about to work dedicatedly on your area of interest, or you want to follow your passion in particular subject, and in this general practice somewhere, if you feel that you want to limit your practice to manage in a better way to get a good patient satisfaction and clinical outcome, you should think about such subspecialty. Now the group 2, where you are currently either a resident doctor in orthopedics, or you have just completed your orthopedic training, so and you are planning to practice in tier 1 and tier 2 city, you need to think about such subspecialty. And also, if you want to dedicatedly work on your area of interest, if you want to explore advanced skill, then also you should go for such fellowships. If you're willing to do institutional practice, you want to join a tertiary care hospital or a medical college or a bigger institute where such subspecialty departments are already there, so in that case, if you have done fellowship, you have a specialized training in particular subspecialty, you will get a better opportunities there. And be prepared. Also, you need to be prepared for the future medical practice, wherein the subspecialty practice will be upcoming trend. Now let's discuss what all are such orthopedic subspecialties. Arthroplastic surgery, which is a joint replacement surgery, pediatric orthopedics, spine surgery, arthroscopy, hand surgery, foot and ankle surgery, shoulder and elbow surgery, sports medicine, trauma surgery, orthopedic oncology, musculoskeletal medicine. So these all are such subspecialties in orthopedics. Now let's see the training options, what are available, different training options if you plan such subspecialty. First is the full-time fellowships at different institutes. Second, short-term fellowship. These are institutional based fellowships, vary from 3 months to 6 months to up to 1 year of training. Observerships available, hands-on workshops, different institutions and different organizations are also arranging such workshops in different minimal invasive of spine surgery or arthroscopy workshop that you can attend also. There are visiting and traveling fellowships also. Globally, a big the established institutes wherein such departments are very well known about their subspecialty work in orthopedics, they are offering such fellowships. There are elective programs for resident doctors and also the online academic tutorials available. So now there are 3 types of fellowships usually. First is university recognized fellowships. These are usually 1 to 2 years of duration. Second is the fellowships recognized by national or international society or association, professional body. And third is fellowships which are offered by institute and hospitals, and they recognized at their level and which are 6 months to 1 year of duration. Now who can do what? So the practicing doctors who can, obviously for them in between of practice it is difficult to go for full-time fellowships, but yes, for the recent practitioners who have practiced 1 or 2 year of general orthopedic practice, they can definitely think about to go for full-time fellowship. So and the other practicing orthopedic surgeons who have more than 5 years of experience, they can opt for short-term fellowship or observership, hands-on workshops, or visiting or traveling fellowship. And for the resident doctors who are pass out recent graduates of MS, DNB or diploma, they must go for full-time fellowships. And yes, if you do not have enough work exposure in general orthopedics, so we recommend that you should join an institute for 1 to 2 years where you get a good enough work, as well as such institute, if they have such subspecialty clinics and departments, it will add a value to your work, and then you can identify your area of interest in which subspecialty you want to go for. After that, you can go for that particular fellowships. Now, how to find such fellowships, wherein DocHub will help you out to find such fellowships. You can go to docthub.com under a courses section. In all courses, you can filter your result in a medical discipline, a stream. If you are a doctor, you belong to a medical field, and you can filter a particular specialty also according to course type and different locations. You can filter your result and you will get different options of fellowships. You can get the information, download brochure, or you can directly apply to that institute also. Now let's discuss the fraternity recognition currently in such subspecialties. International Society for Advancement of Spine Surgery, International Society of Orthopedic Surgery and Traumatology, Society for Minimal Invasive Spine Surgery, International Federation of Pediatric Orthopedic Societies, International Society of Arthroscopy, Knee Surgery and Orthopedic Sports Medicine, International Federation of Sports Medicine, Academy of Minimal Invasive Foot and Ankle Surgery, Indian Musculoskeletal Oncology Society, European Society of Surgery for Shoulder and Elbow, Indian Foot and Ankle Surgery, Pediatric Orthopedic Society of India, European Pediatric Orthopedic Society, British Orthopedic Oncology Society, British Orthopedic Foot and Ankle Society, American Orthopedic Foot and Ankle Society, Shoulder and Elbow Society of India, American Association for Hand Surgery, and Indian Arthroscopy Societies. These all are few fraternities we have mentioned here. There are, I'm sure, every country has their own different fraternities in such subspecialty, and all these societies and professional associations has created the academic environment. They also do academic programs, workshops, training guidance also. So if you are thinking about subspecialty, there are fraternities available who will help you out to opt for such trainings also. So before going for the recommendations, I would request, please comment below if you are doing such fellowship already. Please share your experience. If you are planning for fellowship and you have any queries, please comment below, and please write us what is your view on future of such subspecialty practice in orthopedics. Now the recommendations. You should have enough work exposure in general orthopedics. Second, you should identify your area of interest first, because you should choose the subspecialty only on the basis of your skill and interest, not just to get a job or an earning opportunity. And then you should go for fellowship. After completing your fellowship, you can join a particular institute or any tertiary care hospital where the such subspecialty clinics are available. Also, you can join a group of doctors who are practicing such subspecialty. You can join them, or also you can go for independent practice in such specialty like pediatric orthopedics. You can go for the independent practice also. So that's all for this topic. So if you like our content, please subscribe DocHub channel and click on like button and bell button so that you get the notification of our each and every videos. Thank you.